All right, let's continue our discussion of psychological disorders with a special group of disorders called personality disorders. Let me warn you before we proceed that personality disorders, I mean bona fide, verifiable personality disorders, are relatively rare. And by rare, I mean that it is unlikely that any of your friends, or at least maybe only one, has a bona fide personality disorder. Although one may believe that half of them may have some personality disorders. And the fact is that a truly bona fide personality, one that is verifiable and diagnosable, is I mean, by rare, I mean you're in the very low percentages of the population, and we'll get more into what the prevalence of these various personality disorders are to a degree. We could spend an entire semester, if not a year, going over this. I spend sometimes as long as a semester, if not two, just in the academic characteristics and with personality disorders with graduate students, and then the actual clinical procedures are an entire different bag of worms. So what just is a personality disorder? It is a deeply rooted, and they usually span for many years. They start in childhood and then develop from there. But they are clusters of maladaptive personality traits. Any personality disorder is as if the individual is walking around in a bubble and or a dark cloud over them constantly everywhere. So it is a persistent pattern of emotions, cognitions, thoughts, behaviors that result in enduring emotional distress for the person affected, and the other way as well, and for others, and usually they do cause difficulties with work and relationships. So let's look at these characteristics of personality disorder. It's an enduring pattern of inner experience, and it lasts for the individual's lifetime often. It's pervasive and inflexible. It is inflexible. It has an onset in adolescence or early adulthood. It's stable over time, as almost all personality traits are, and these are just over the top traits. And it leads to some form of distrust or impairment. The types of personality disorders are in three clusters, A, B, and C, as you can see here. And cluster A are those odd and eccentric types: paranoid, schizoid, and schizotypal or typal. B, cluster B, dramatic or erratic, which includes antisocial, borderline, histrionic, and narcissistic personality disorders. And cluster C, sort of anxious, the basic description, anxious and fearful, those who are avoidant, dependent, and obsessive compulsive personality disorders. Let's start with cluster A, and the first one is paranoid personality disorder. Now, I pulled some DSM-5 diagnostic criteria for these various disorders, for some of them at least, and put them on the slide here as well. You're certainly free to read them. I'm just going to go through an overview of these and look at the pervasive clinical features. And the first one is a pervasive and unjustified mistrust and suspicion. Somebody with a paranoid personality disorder is suspicious of everything and everybody. They have few meaningful relationships, and they're extremely sensitive to criticism. Very poor quality of life, consequently. Cluster A, also schizoid personality disorder. By the way, and I just put like images or photos of individuals or characters in fiction or real life that remind me or of that disorder, or just they seem to have characterized some of these disorders. And Gollum from Lord of the Rings seems to strike me as one with a schizoid personality disorder. And there's a pervasive pattern of detachment from social relationships and a very limited range of emotions in interpersonal situations. Schizotypal or schizotypal personality disorder, these people seem to be quite, they are the epitome of eccentric. So the dress is odd and unusual. They tend to be socially isolated and also highly suspicious, probably because they get criticized or looked at a lot. Magical thinking, ideas of reference, illusions, things that put things together that associate two things that aren't really associated. Now, this isn't delusional. This is not a delusional disorder, though. This is a personality disorder. This is somebody who runs around and looks for UFOs all the time. Only UFO-ADER, schizotypal personality disorder. Okay, this is, by the way, and UFO-ADER is exactly that, but it is also makes an acronym for the diagnostic criteria for a schizotypal personality disorder: unusual perceptions, friendless except for family, odd beliefs, affect inappropriate, ideas of reference, doubts others, eccentric and reluctant in social situations, and anxious. Moving on to cluster B, in which there is antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder. Antisocial first. People tend to be really interested in antisocial. The cluster B, because it is sort of an active, out there personality disorder, or those who suffer from it, because we suffer from them as well. Now, antisocial personality disorder is not somebody who doesn't like to be around others. On the contrary, it could be just the opposite. So this is a person who lacks a conscience. And I've got a few images there of people who are diagnostically antisocial personality disorders. Ted Bundy there on the left, and Bertie Madoff there on the right. Here in the middle, that's from a film, an early Stanley Kubrick film, I think it's like 70 or 71, called A Clockwork Orange. I think it was Malcolm McDowell's, at least one of his first major film role when he was quite young. But antisocial personality disorders include sociopaths and what we call psychopaths. And I put, a couple of fictional psychopaths there. But in that, we see the criminality and antisocial personality and antisocial psychopaths. We see psychopaths, non-psychopaths, and naturally we see more diagnostically diagnosed psychopaths there in the graph there in the red. They tend to be in prison more than those who are not diagnosed as psychopaths. So next cluster, within cluster B again, we have a personality disorder called borderline personality disorder. This, in some ways, may be if it is not the most prevalent personality disorder, it is one that is the most treatable. Now, mind you, any personality disorder is very, very difficult to treat. Start right there. There have been techniques that have been developed, evidence-based techniques to treat borderline personality disorder. So it is treatable, but it is extensive. The borderline includes unstable moods and relationships, impulsivity, self-mutilation, sometimes suicidal gestures, and the comorbidity rates, that is, along with other disorders, they're high with individuals with borderline personality disorder, particularly mood disorders, particularly depression and or bipolar, bipolar A, bipolar 1 or bipolar 2. The histrionic personality disorder exemplifies one who is, or is exemplified by one who's overly dramatic and sensational. They may be sexually provocative. Often they tend to be impulsive, need to be the center of attention, always make a dramatic entrance. And it tends to be more commonly diagnosed in females. But I think that that may not be necessarily true or relevant today. And then next, we have what's called narcissistic personality disorder. Been a lot of talk about that in the last 6, 7, 8 years. Exaggerated and unreasonable sense of self-importance, preoccupation with receiving attention. There seems to be a lack of sensitivity and compassion for others, and very highly sensitive to criticism, and envious and arrogant. That marks the a narcissistic personality disorder. So I've got on the right there a little pie chart showing basically what the diagnostic criteria are for narcissistic personality disorder, and they need to all be there. They believe they're special, they're envious, they have power fantasies, they're arrogant, haughty, require constant admiration, and a sense of entitlement. Now, I see people with maybe 2 or 3 of these traits going on every day. Remember, the mark of any antisocial, or not antisocial, the mark of any personality disorder is that they are continuous. You might see a little spurt of any of these characteristics in anybody, including yourself. Doesn't mean you have a personality disorder. So all of this stuff needs to go on all the time. So I put here the diagnostic criteria for narcissistic personality disorder, and let's go through it. A pervasive pattern of grandiosity in fantasy or behavior, need for admiration, lack of empathy, beginning by early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. Okay, let's go through these. Has a grandiose sense of self-importance, exaggerates achievements and talents. 2, is preoccupied with fantasies of unlimited success, power, brilliance, beauty. 3, believes that he or she is special and unique and can only be understood by or should associated with other special people. 4, requests excessive admiration. 5, has a sense of entitlement. 6, is interpersonally exploitive and takes advantages of others to achieve his or her own ends. 7, lacks empathy, is unwilling to recognize or identify with feelings and needs of others. 8, is often envious of others or believes that others are envious of him or her. And 9, shows arrogant, haughty behaviors or attitudes. Now, only 5 of those need to be present to be diagnostically relevant. Now, of course, only a trained and licensed diagnostician can make any kind of diagnosis, but especially for a personality disorder. But you know, we all have brains as well, and can look around our environment, and especially people who you are well associated with, and see what's there. But to be official, it's got to be a licensed professional. Cluster C, avoidant, dependent, obsessive compulsive. The avoidant personality disorder has extreme sensitivity to the opinions of others, is highly avoidant of most interpersonal relationships, is very interpersonally anxious and fearful of rejection, has very low self-esteem. The dependent personality disorder has a reliance on others to make major and minor life decisions, has an unreasonable fear of abandonment, and is clingy and submissive in interpersonal relationships. Again, now remember, these are this doesn't mean your last relationship. This means this is about somebody who is this way in everything all the time. Everything. And cluster C, obsessive compulsive personality disorder. Different from an obsessive compulsive disorder. So the clinical features include excessive and rigid fixation on doing things the quote unquote right way, highly perfectionistic, unwilling to delegate tasks because others will do them wrong, and difficulty with spontaneity, like doing things like spur of the moment, often has interpersonal problems, and obsessions and compulsions are rare because they get them to do it. So, the obsessive compulsive personality disorder, in some ways, is extolled in our culture, in our society, to be achievement oriented, and achieve and produce. And then in other ways, though, we don't like the quote unquote control freak. And in every way, shape, and form, an individual with an obsessive compulsive personality disorder will present to anybody as a control freak. So somebody who micromanages and somebody who's everything just has to be his or her way. Not because they believe that they are necessarily superior, but that individual does believe that only if they do it, will it be done the quote unquote right way. So that's the obsessive compulsive personality disorder. And in fact, those are the personality disorders in a nutshell, literally. But I would be remiss if I also did not talk about suicide and risk factors in any course of intro psych. One needs to be introduced to what are some of the characteristics of one, or the certainly the presenting issues of one who would think about, let alone commit to in one's life. So what are some of the major risk factors in one who might commit suicide? Gender related, men are more likely to complete suicide, or in other words, if you can stand the phrase, a successful suicide is what that is. Women are more likely to attempt it. Ethnicity, suicide rates are vary dramatically from country to country, and they really do. They vary dramatically. Age, suicide rates increase with advancing age. And marital status, married individuals have lower rates than divorced, widowed, and single people. Some of the immediate causes are altered states of awareness, drug and alcohol abuse, in other words, a prior suicide attempt, a depression or other mood disorder. But you need to understand that depression is not necessarily cause for suicide. Many people commit suicide and they were not depressed. Availability of a firearm, severe anxiety or panic attacks actually could be more of a causation. Family history of suicidal behavior, and current shame, humiliation, failure, or rejection, which in some cultures is far more important than in other cultures. Some warning signs of impending suicide include direct threats to commit suicide, like, hey, I'm going to go kill myself and I got the means and ways to do it. A preoccupation with death, again, depression, but particularly, and I put that there, hopelessness. So when somebody is depressed and they're hitting some of the diagnostic criteria of depression, remember that it is the hopelessness piece that really connects or completes that puzzle. In fact, Aaron Beck and his group created two measures for anxiety and depression related disorders. One is called the BDI, the Beck Depression Inventory, and it is a 21 item self-report questionnaire rather for depression. We use that quite often. The scale goes from 0 to 63. Then out of that also then came the Beck hopelessness scale, because hopelessness is really at the upper end of what depression is about. Then one who is into aggression and risk taking, and again back to the previous slide, alcohol or drug abuse, or in other words, any form of altered consciousness. Withdrawal, no sense of purpose in life. Again, that goes back to hopelessness. Sudden mood swings. Be careful of that, because that could be that could be a psychogenic issue as well as a chemical or mood altering substance issue, or sudden mood swings. Personality change, same thing. It could also, that personality change could also may be due to perhaps a head or head injury that you might not have been aware of. A giving of prized possessions. If somebody suddenly gives away their most prized possessions, what's going on? And the recent occurrence of life crisis or emotional shock. These are warning signs of a possible impending suicide. Warning signs only, but as they accumulate, of course, the warning sign gets bigger and bigger. Some common characteristics of suicidal thoughts and feelings: escape, unbearable psychological pain. I don't know about you, but I find that emotional and psychological pain is, I view that as more painful, greater suffering involved than physical pain. Frustrated psychological needs. There's looking for love or relationships or achievement or security or something. It's not there. And a constriction of options, feeling helpless, hopeless, deciding that death is the only option left, which that in and of itself is not logical, because death then is zero options. Within crisis intervention, and this is very, very general now, this isn't a crisis intervention course, but just generally speaking, give a person who seems to be suicidal the number of a mental health crisis intervention, help the person make an appointment to get psychological treatment, and if a suicide attempt seems to be imminent, immediately seek professional assistance by calling the police, crisis intervention, or a rescue unit. Be very careful, though, in doing that. Many times a crisis situation with somebody who is highly emotional distraught can appear to be a danger to those coming to professionals to professional assistance. So be really careful of that. You could actually end up causing the person more harm. So with that in mind, I think we're done and finished talking about psychological disorders.